A little bit, so I'm going to go ahead and kick us off. But thank you so much for joining us for our Systems for Action Research and Progress webinar series. If you are not familiar with Systems for Action, we are a national research program office funded by the Robert Wood Johnson Foundation, and we're housed at the University of Colorado and the Colorado School of Public Health in the Health Systems Management and Policy Department. And Systems for Action has been funded since 2015 by the Robert Wood Johnson Foundation. And one of our main goals and activities as a national program office is to develop and release annual funding opportunities, soliciting ideas for innovative ways of aligning systems. So we're really interested in ideas of aligning the medical, public health, and social service systems. To date, we have funded around 50 research studies all across the country. And they're all in different topic areas and focus areas. And this Research in Progress webinar series that you are attending today is one of our ways of rapidly disseminating what's happening with these research projects, what they're planning to do, what they're doing sort of midterm in their research projects, what their preliminary findings are, what barriers they're experiencing. And then we also invite the researchers to come and present when they have some final findings for you. So this is just a good avenue for you to come in and feel like you're part of the journey for the research teams. Today, you are going to be hearing from one of the research grantees funded through our System Alignment Innovation Hub. And I believe we have one of the leaders here of the Innovation Hub to kick us off and introduce the Equity Capacity Building Grant process that this team at in Oklahoma, the Evolution Foundation is here to talk about today. So, Dr. Lamont Green, do you want to hop on and give a quick introduction?
Sure. Thank you, Carrington. And good morning, good afternoon, everyone, depending on where you're joining from. I'm Dr. Lamont Green, founding co-director of the S4A Systems Alignment Innovation Hub. And before we move into the feature of today's webinar, I want to ground us in why the Hub exists and why this moment truly matters. First, I want to give a deep gratitude to the Systems for Action National Program Office, Dr. Mays, Carrington, and their incredible team, to the S4A National Program Advisory Committee, to RWJF leadership, Dr. Plow, Dr. Cuevo, and their teams, for their vision and courage in making the Hub a reality. And of course, to my co-director, Dr. Espinosa, couldn't do this without you, and our phenomenal Systems Alignment Innovation Hub team, William Yee, Dr. Nathaniel, Regina Cannon, and Jeffrey Thomas. And most importantly, our grantees, Community Power Network members and partners. Because of you, this work breathes. So the Systems Alignment Innovation Hub prioritizes community-led systems alignment research to better address health inequities. And if we're honest, research in this country has not always been neutral. It has been shaped by systems, and those systems have been shaped by structural racism, economic exclusion, ableism, colonialism, and other forms of oppression. And for generations, well-resourced institutions have defined the research questions, controlled the findings, and interpreted the data. Meanwhile, community-based organizations, especially those led by and serving Black, Brown, Indigenous, immigrant, LGBTQ, rural, and disabled communities, have too often been positioned as subjects or implementers rather than leaders. And so the Hub was launched in November 2022 to interrupt that pattern. Its purpose, bold but clear, to empower community-based organizations to access, develop, and lead systems alignment research, particularly those serving communities disproportionately impacted by disease, injury, and health disparities. Because we know when communities that are closest to the problem lead research, the question shifts, the metric shifts, and the definition of impact shifts. And so through the Systems Alignment Innovation Hub, we provide a host of support and resources. We provide free technical assistance and consulting to organizations through the Equity Capacity Building Grant in partnership with S4A and RWJF. We provided some funding. the Community Power Network, where community organizers and system leaders and people, we all come together to support each other, to share tools and resources, to lift each other up, all rooted in community, rooted ideas and evidence guiding systems alignment, research, and implementation. And so our equity capacity building grant has been a key part of our work. And the Evolution Foundation received funding in that first cohort. And so today's webinar is featuring the amazing work that they've been doing to advance equity by strengthening how organizations measure impact, learn, and drive systems change. And their work is really grounded in not only confronting and dismantling structural racism and other systemic barriers that shape health, opportunity, and outcomes. And so, with that, it is my honor to introduce Shamika Williams. She's the president and CEO of the Evolution Foundation, and their evaluator, Miss Geneva Stretch.
Thank you, Dr. Lamont Green. Well, we're really excited about today to share a little bit about our project. Our project is titled The Past is Still Present. We're going to talk about the historical trauma that happened in Tulsa, specifically North Tulsa. And then we're going to talk about our equity capacity building and what we're actually doing in order to address some of the goals and the needs for this particular community. Next slide, please. Again, we want to thank the S4A Systems Alignment, Robert Wood Johnson. We also want to thank the Systems Alignment SAIH Hub, Innovation Hub, for allowing us to take part in this project. Who are we? Again, the Evolution Foundation. The Evolution Foundation is a nonprofit organization with the purpose of advocating for resources, services, and support for children, youth, and families who have complex needs in the areas of physical health, mental health, substance use, and well-being. What we do is we really connect families to resources in local communities. We work with coalitions across the state of Oklahoma and other places in order to build strength and alliance to coordinate efforts around children, youth, and families. We also collaborate with behavioral health networks on initiatives to meet the needs of children, youth, and families, offering training, community engagement, leadership, community culture, humility, and more. And so the Evolution Foundation as a nonprofit, again, work with the North Tulsa community in order to apply for this opportunity. In 2025, the Evolution Foundation was awarded the Robert Wood Johnson Grant. As a part of the grant, there were two specific goals that we wanted to two specific goals that we wanted to accomplish. We wanted to engage and collaborate with North Tulsa community to support the healing of intergenerational trauma, which fosters pathways towards collective resilience and health and well-being. We also wanted to build the capacity of Black-owned mental health provider agencies through targeted support and organizing infrastructure, really working on billing and reimbursement systems, program development. We also wanted to expand services in order to meet the needs of the community by improving finances, sustainability, and better ways to meet the needs of the community. So today, what we're going to do is really do an overview. We want to talk about the history of the North Tulsa community and really some of the ongoing needs. We wanted to define the historical trauma and explain its intergenerational transmission across families and the community. And then also define the capacity to build and explain its role in strengthening organizational sustainability and the long-term impact of that. Many of you have probably heard about Black Wall Street. Black Wall Street refers to the Greenwood District of Tulsa, Oklahoma, one of the most prosperous Black communities in the United States in the early 20th century. It earned its nickname because of its concentration of successful Black-owned businesses, professionals, and institutions, all built in a segregated society, which restricted for Black residents who could live, work, and shop. So this was a restricted community that was again, built specifically around Black businesses, Black professionals, and institutions. The community really thrived economically, which was the cultural hub located in North Tulsa. Hundreds of Black-owned businesses, including banks, hotels, theaters, restaurants, law offices, medical practices, newspapers, really were thriving in the North Tulsa community. So this particular slide, you'll see some pictures on the slide, and we thought it was extremely important to share some of the pictures so that you can have a synopsis of really what took place in in the Greenwood district. Again, we have slides that will share information on specific conferences where Black professional professionals were able to come and really connect around a conference that was taking place in the North Tulsa community. And these professionals, these doctors were from around the world. In addition to that, you'll also see slides where it actually shows, Geneva, if you would go back. Okay. You'll also see slides that talks about how in 1921, a race mob destroyed the community in one of the most vulnerable episodes of racial terrorism in the U.S. history. Again, this is where this particular race riot came in, set fires. They had assistance from the military in order to destroy this Greenwood district. In addition to that, you will see slides that show the devastation of that district and how people, African American people, were forced to really work and go through the rubbish in order to find their possessions in order to begin to try to restore their community. And so these pictures are real pictures of actually what happened in community. This particular photo shows the devastation of the Greenwood district. As I mentioned, this was an act that was actually taking place where the military actually came in and supported the mob. There were bombings and different fires that were set as a part of that. And so, again, when you look at this particular picture, you'll see the devastation of how both the military as well as rioters came into this particular community in order to destroy it. Despite the abuse of the government, Greenwood really worked to rebuild as an aftermath of the massacre. And so community folks and people who lived and had business began to really gather their possessions in order to begin to move forward with rebuilding Greenwood after the massacre occurred. Next slide, please. Again, you can see in this particular side where this particular African American community was thriving. This is a part of the rebuild. There were various stores and various drugstores, medical facilities. You'll also see there was a newspaper called the Oklahoma Eagle that was predominant in the community at that particular time. That's where African American people received and obtained their news information, as well as other information to alert the community about what was going on. One of the things that's really interesting during this particular time is that a lot of the media portrayed this particular incident as an incident that took place because of an African American man who violated a white woman. And so during this time, the media was portraying this was an act that was done because of a violation of a white woman by an African American man, which actually started the mob activity. And so again, during that time, the false information that was being put out in the media was really creating a difference in how the North Tulsa community viewed government, how they viewed systems within the Tulsa community. Viola Fletcher was an actual survivor of the Tulsa massacre. She wrote a book, Don't Let Them Bury My Story. Again, when Viola Fletcher wrote this book, she wanted to make sure the survivor stories were a part of the real truth of what took place in the Greenwood community. And so, as we talk about enduring the impact of the historical trauma, you'll see how the devastation of what took place during that massacre and how buildings were dilapidated, they were burned down, they were immediately destroyed. But the Tulsa, back in 2021, the Tulsa descendants decided um, to sue the government as it relates to the massacre. As stories begin to come out from these survivors about what actually took place in 2020, the survivors of the race massacre began to sue the city of Tulsa as well as the government. One of the things that was interesting during that time is, in many cases, the stories about what took place in Greenwood was really painted by the media. The stories were actual false stories that were coming out. And so not until 2020 did this community really have an idea of really what took place in this Greenwood district. So in 2020, when a lawsuit was filed, people began to understand the story around the history of Greenwood. They began to understand how the government was a part of allowing and participating in this particular massacre. So again, if you can imagine a North Tulsa community hearing real factual information for the first time compared to what was actually written in the storylines and in the storybooks prior to, this was definitely devastating. And so the community of mental health continues to be impacted by the loss of inherited wealth, ongoing fear and violence, and the ensuring of family history. And so again, currently, not even 6 years ago, when what you would call our Gen X's and our baby boomers were hearing what actually took place in Greenwood, this was new information to a lot of folks. And so imagine receiving new information about factual information that took place in Greenwood for the first time, even though you may not have been born during that time. Again, that's quite traumatic. And then also the stories that have been handed down um, through the years from actual survivors and the stories that they had told really painted a glim picture for individuals in the North Tulsa community. We also must remember, again, redlining is one of those things that actually takes place in a lot of African American communities where highways were often put into place and created infrastructures for systematic racism, intersect highways plan and intentional government policies that implemented across communities to disrupt African American communities. So this is a picture where once the William Greenland Theater set, and so now this particular community, it sits a highway that sits right in the same spot of that theater. And so again, the government has they had the ability to create opportunities for redlining in order to again to really wipe out certain communities. Next slide. This is a picture where you can see, again, the highway picture. This is a picture where you can see how this particular highway runs directly through the Greenwood community. This is a more modern picture of today as the community rebuilt some of its infrastructure in order to continue to provide support and services to the North Tulsa community. Next slide. And so when we talk about the impact of historical trauma, today Greenwood and its border North Tulsa really remains majority Black. The majority of the population who live in the Greenwood district as well as North Tulsa are African American individuals. After more than a century, disinvestment in marginalized North Tulsa poverty rate continues to be at about 20.1% higher than what you would see in the southern parts of Tulsa. And so when you look at poverty in this particular community, the rates are much higher than what you would see in the southern part of Tulsa and even in some other communities. Next slide, please. One of the things that's really important as the Evolution Foundation began to work within the North Tulsa community and the coalitions, what we found is that the community was still frustrated with city government as well as federal government. Communities felt like that the survivors and the descendants of the survivors should have some benefits as it relates to really destroying their wealth. And so the news stories, as I mentioned, that came out after 2020, that really begin to tell the truth. People had harsh feelings. And so when we would formulate community meetings, people wanted to talk about their trauma, talk about that impact, talked about how it actually went down through generations of individuals and the impact of it today. One of the things that was really the most important is the impact that it had on mental health providers that were serving individuals in the community. And so I'm going to hand it off to Geneva, and she's going to talk through some of our facts, our data facts that we were able to identify early on as a part of this project. You're going to have to come off mute.
Hi, everyone. This slide is just national data that I pulled to set a little bit of the context because the story is a little bit different in Oklahoma, but you can see that Black youth and young adults in the U.S. experience more illness, poverty, and discrimination than white youth. They're less likely to ask for help, with about 9% reporting major depression in the last year, but only about 40% of them try to get treatment. And their families may be less likely to identify mental health issues, and they may enroll in treatment less often. They're less likely than white youth and young adults to be treated with medications and more likely to be hospitalized involuntarily. It's systemic racism, right? Which we can see in this data. And Black youth and young adults with psychiatric disorders are more likely to be referred to the juvenile justice system rather than the mental health system. So what does that look like in Oklahoma? So the Evolution Foundation has had a long-term and ongoing partnership with the Oklahoma Department of Mental Health and Substance Abuse Services. I was the lead evaluator for Oklahoma Systems of Care for many years, and this is actually Oklahoma data. The data that we pulled to look at this comes from our outcomes data, where we use a psychometric measure called the Ohio Scales, which lets us look at baseline impairment on problems and functioning, and then we look at improvements over time. And so what you can really see when we look at these outcomes by race and ethnicity is you can see that for this chart, I put Black youth as the darkest color because we were focusing on that. But it's really interesting when you look at all of these across the scale. This is clinically significant improvement at 6 months. This first chart here. And you can see that Black youth are experiencing, or 56% of Black youth are experiencing clinically significant improvement. Hispanic and Native youth actually experience higher rates of clinically significant improvement. We think that that's because systems of care and wraparound are built on family and community supports, so natural supports as well as professional supports. And so those communities are able to access more natural supports. You can see that days in out-of-home placements, Black youth experience a 19% improvement, while Hispanic youth experience a 40% improvement. Days in school suspension, you can see Black youth experience a 42% improvement. Hispanic youth experience a 73% improvement. The days in out-of-school suspension, there is an improvement. It's interesting how much these graphs kind of look alike, right? And then self-harming is there too. I also want to look at this. When we look at the difference in internalizing disorders, which are anxiety, depression, things like that, and externalizing disorders, which are acting out disorders, conflict behavior disorders, ADD, ADHD, oppositional defiant disorder, those kinds of things. Internalizing disorders appear less frequently among Black youth and young adults, but they're scored. Those same Black youth and young adults are scored with higher impairments than others with the same diagnosis. And externalizing disorders appear more frequently among Black youth and young adults, but they're scored with lower impairments. That means that the traditional diagnoses that we consider acting out diagnoses or behaviors that might be causing problems for the youth or the family, those disorders are being identified earlier in Black youth, even though their impairment scores are lower than white youth. Again, systemic racism. when we look at it for males and females, we can see that over these fiscal years from 2018 to 2021, there were dramatic reductions in out-of-home placements in the first 3 months for boys, with some loss of ground in the 3 to 6 month period. With females, the reductions are more gradual but steadier, and they improve throughout the first 6 months. So we just want to look at all kinds of differences among age as well as race and ethnicity and then gender. So we can see how our programs are helping different populations. So we know how to change what we're doing so we can make changes in practice. Shamika, you want to take the goal? You're on mute.
So as a part of this project, we wanted to work with the five um, Af African American owned mental health agencies in the North Tulsa community. It was really important that we look at how could we literally build these organizations up to begin to provide better services and serve children, youth, and families at higher rates. We wanted to also look at the impact of that. If we were able to identify specific areas that we could build, how would that actually impact the community and the individuals that are being served? So some of the goals for our project was to engage and collaborate with North Tulsa community in supporting healing to integrate trauma while fostering pathways towards collective resilience and health and equity. And how we said that we wanted to do that is we continue to have ongoing dialogue. We did some shared planning and relationship building, ensuring that work is grounded in the community priorities, historical context, and lived experience. In addition to that, we also engaged in efforts to emphasize transparency, mutual respect, accountability, community voice as a driving factor for the outcomes rather than passive sources of feedback. Next slide. The systems alignment to advance health equity, the Evolution Foundation and our partners are working across cultural, health, education, and social service systems to reduce fragmented and address systemic barriers that disproportionately impact the North Tulsa residents. Some of the measures that we're going to use is establishing a cross-system partnership among the five community-based cultural and health-related organizations to coordinate services and share data. Next slide. We want to look at integrating trauma-informed and culturally responsive practices within 100% of our partnership program in order to serve the community. So it's really important that we help to train and educate our providers around trauma-informed services and make sure that the practices represent the community. We're going to also increase community participation in health promotion and health-centered programs by at least 25% over the 2-year period. Track improvements in selected community identify indicators such as access to preventative care, mental health resources, and culture-relevant wellness programs through evaluation and community feedback. The second goal is to build a capacity for the Black-owned mental health provider agencies, where we're actually going to provide targeted supports in organizational infrastructures, billing, reimbursement systems, and program development, enabling providers to expand services, because if they're able to expand service, they're able to see more citizens in the North Tulsa community. We also want to look at improving financial stability. A lot of our providers, again, they're not as competitive as some of the monopoly providers, some of the bigger organizations. So really looking at, ways to look at the Medicaid infrastructure, how to position them where they can actually go after grants and opportunities that will actually help them to obtain the the finances that they need in order to be effective. How does mental health provider capacity impact intergenerational trauma? Early identification and intervention, that's really important. Really making sure providers are well trained and able to spot trauma-related signs among children, parents, and elders. We also want to make sure that they utilize trauma-informed care by adopting trauma-informed methods. Providers will cultivate environments that are safe, supported, and really help to maximize re-traumatizing and promoting overall health. Trauma-informed practices are extremely important for communities to use, especially in a community like the North Tulsa community, as they have the history of the Greenwood Massacre. Community education, really building provider capacity to ensure them to inform families, and the broader community about trauma. I think it's, again, it kind of goes with that. It takes a village concept. It's not just important to provide treatment and services and supports to youth, but also how do we educate community as a whole in order to understand the impact of trauma, how to use effective coping mechanisms, again, and really looking at those resilience factors that really make a difference. Next slide. Cultural sensitive practices, providing skills to uh, clinicians, incorporating understanding around the historical and the cultural of trauma. Again, as I mentioned early, a lot of these stories have moved down generations from the descendants of the massacre. And so, how do we approach those? Again, making sure that we're culturally sensitive in our practices and understanding that oftentimes what young people hear from their family members or caregivers does have an impact. We want to also strengthen family and social systems. Really, what providers can equip parents and caregivers with mental health strategies, improve family relationships, and foster and nurturing environments. Again, that's really important to strengthen the family, strengthen families as we're really working with the community. And then policy and systems change. I think it's really important to really look at a greater capacity for providers to be able to advocate for policies and programs and resources that address the root cause of their trauma and really that address the root cause of their communities, really working to advocate for better opportunities for economics within the North Tulsa community, also making sure that elected officials understand the impact of this trauma and how they can provide better support. And then also funding. How do we really move towards looking at opportunities for funding as we continue to advocate for these providers in the community? Um, as we work to build the capacity with these mental health providers, I think it was really important for us to really help those providers to really understand how they can elevate by developing work plans for them, individualized work plans that they can, work towards accomplishing in order to build the capacity they need. We're really looking at areas of human capacity, really working to enhance clinical expertise, emotional strength, and ethical standards to evaluate care, the quality of the care, supporting providers with ongoing education, regular supervision, and self-care resources. Again, this really helps to make sure that the infrastructure and the fabric of the workforce within those provider agencies have the resources and the support that they need in order to be effective. Organizational capacity is really building a robust system, strengthening leadership, and sufficient resources to ensure services are effective, ethical, and enduring, enabling organizations to offer high quality, culture sensitive care while prioritizing staff and well-being. That is really important because again, a lot of these agencies do not have the financial resources in order to go to opportunities such as leadership building, opportunities that really help them to look at the ethics of their practice and then how they do practice. And so, again, being able to bring those types of trainings and opportunities to those providers in the community is really important. When we look at political capacity, we want to make sure that we increase the skills and help them to understand advocacy and policy engagement. Help them to understand strategies for the decision making that helps to shape the mental health system in the state of Oklahoma. That understanding alone can really help providers to, again, in their advocacy around the services and supports that they need, and making sure that we're providing knowledge and tools for providers to impact legislative. That comes into play when we're talking about funding, fair mental health services. Oftentimes, as I mentioned, the field can be quite competitive. And so really making sure that they are advocating for policies and opportunities to better serve and support their community. Structural capacity, really opportunities to enhance their infrastructure and organizational structure. Oftentimes, this could be opportunities for, position decisions, training opportunities for the staff, making sure that the organizations have the ability to have stable funding, really working to integrate with systems so providers can often rely on high quality mental health care. And so really looking at how do we help within the structure component to build those organizations so that they have the stability to better serve and to provide high quality mental health services across the North Tulsa community. Next slide. As I mentioned, how we will be looking at some of those indicators around human capacity and organizational capacity and the other ones. In reference to human capacity, we're going to be looking at the number, the percentage of staff trained in clinical skills. We're going to be looking at improvements in knowledge and competencies, pre and post test training, staff retention rates. I mean, that is really important. Staff retention and really hoping to eliminate burnout when it comes to those mental health staff. Self-reporting of confidence. How does those trainings and those opportunities really build confidence in their ability to deliver mental health services? And then also participation in supervision, mentoring, and continuing education programs. We know that oftentimes these mental health agencies don't often have the funds or the resources to provide extended training and opportunities for continued education. And so again, because of Robert Wood Johnson, we'll be able to provide some of those services and supports so that staff feel like that they have the competent skills in order to serve individuals in the community. As we look at organizational capacity, again, looking at policies and procedures, helping those organizations to lift up their policies, procedures to make sure that they are in line with the organization's goals and mission, implementing quality assurance and monitoring systems. How do we know that this is going to be effective? Of course, we will have specific data indicators from the individuals that they serve to really look at how we can do that. Leadership and management training completed by key staff, making sure those supervisors and those managers that are in key positions not only are able to do their role to operate within their role and expectations, but to also to make sure that they're not only keeping an eye on the individuals that are being served, but also being supportive to those that are serving the individuals, the practitioners and providers. Um, Implementing protocol for patient care and record keeping and reporting. Making sure that our providers are meeting the standards of our Medicaid agency, our healthcare authority, in order to make sure that their record keeping, the patient care is in line with the requirements from the authority. And then not just from the authority, to make sure that they're in line in order to make sure that they have successful outcomes specific to reporting for certain billable services, making sure that they're in line with the Department of Mental Health and the protocols that they have. Staff satisfactory and engagement surveys. You know, we feel like it's important. We know that when staff are excited or happy about their job and their roles, again, that prevents the burnout. The staff stay longer, and they're able to provide much better services. Next slide. As we talked about political capacity, it's really one of the things that was really important for this community is that ability to advocate for state through city and state government. Really looking at opportunities for them to participate in sharing their stories with decision makers, looking for opportunities for them to sit in city and state meetings as stakeholders so that their voices can be heard. And then also looking at opportunities for mental health policy and advisory committees. All of our state agencies have boards, and they are the decision maker, and as well as our legislators. But how do we get these individuals from this particular community to be a part of those boards and committees so that they're advocating for the needs of the North Tulsa citizen and African American families? Partnerships will be established with government and community groups. Again, we have several different groups that are taking place in the Tulsa community. We have several different groups that are taking place within the state of Oklahoma, but none of these groups represent this particular community. So it's important that we make sure that these individuals are a part of those groups. And it's also important that we actually help them to learn about the importance of lobbying and advocacy as it relates to the work that they do and the need for that particular community. Structural capacity is really around, we'll be looking at the availability and adequacy, mental health facility, equipment, and technology. Again, making sure that these organizations are in compliance so that they can properly bill, making sure that these organizations are positioned in the community so that folks know who they are and where they are. And also making sure that, again, looking at specific equipment, as in telehealth is such a big thing, and a lot of these organizations don't have those types of equipment, but ways that they can, again, create access to services and supports in order to meet the needs of the community. And then also really looking at how mental health is integrated with the overall health and how to not just work with individuals around the mental health capacity, but that holistic health approach. And then also sustainability funding mechanisms in place. Again, many of these agencies, as I mentioned, have not been as competitive with grant opportunities, whether it's federal, state grants, but making sure that they understand, how to be competitive, such as grant writing opportunities, opportunities to co-support one another in grant opportunities where they can come together as a cohort in order to seek opportunities for funding. And then one of the most important is really looking at a standardized data collection and reporting system for implementation. Again, how do you tell your story? The story is told in the data. The data provides the examples and it shows the effectiveness of these projects. So really working with them to making sure that they have a way to do data collection, not only internal for the services, but also collect data again across all the different domains. Next slide. So Geneva, you want to go ahead and take this one away and just rehash it around the evaluation? You're on mute.
What we're looking to do in working with these organizations is help them with this, with their own evaluation so that they understand how to look at the measures they're currently collecting, which they have to do as a part of, receiving Medicaid funding and things like that. And also looking at how we can implement a shared evaluation so we can use the power of the group and their voices together to highlight what's happening in the community. And so that's actually a mural in Black Wall Street. So I thought it would be good to end on a happier note because some of those pictures, they are traumatic, and going into that community and hearing the stories and understanding that so many people in that community have not been heard yet. And so trying to talk about capacity building when, that seems like something that's maybe not the most important thing right now. I think the work that the Evolution Foundation has been doing, Shamika and her team, has been really amazing. And we are looking forward to bringing the full evaluation to everybody once we get, once we get that in place.
One of the thing that was really important for this community is really to teach them how. It's kind of like you can you can catch a bundle of fish and give it to individuals and they can eat, but you can teach them how to fish and they can eat forever. And so by building these capacities within these organizations to better be able to understand the dynamics of mental health services across the spectrum, being in compliance, making sure that the workforce and providers really understand the culture of the community in order to better serve the community, understanding the importance of data and evaluation, how to show your effectiveness, helping them to understand how to advocate for themselves as a community, as well as helping them to understand how to go after future funding as an opportunity has really been important for these providers. And so, again, thanks to Robert Wood Johnson for the Equity Capacity Grant, because during this time, there's no other way we could have made this possible without Robert Wood Johnson. One of the things that I think is important before we go to questions is I think it's really important to say this because during a time where many people have not been able to address the diversity of communities because of because of the limitations of DEI and other things. Folks have really shied away from working in partnerships where addressing the needs of people of color. And so this particular partnerships allowed us to really begin to think about the needs of people of color in order to begin to take a step back to look at what is it specifically that community partners need in order to better serve and support their community. We believe it takes a village to do this. And so the North Tulsa community has been that village that has been leading the way for the North Tulsa community in order to make sure that families of color, families in the North Tulsa community have equal easy access to mental health treatment and supports to better serve and support their community. So again, I thank you for that. And I will send it back to Dr. Um, Lamont Green. So I do see some questions in the chat. Carrington, do you want to read the questions in the chat?
Absolutely. I want to thank you so much for coming and inviting us into your work and letting us know what you're doing. And I think what really stood out to me is that community building piece, not only working with the community members, but also the organizations that are working to serve those community members, and how a lot of the objectives of providing TA and supports with them kind of helps to make sure that there's not overlap and just working smarter instead
Absolutely.
of harder. And also, like right now in this funding landscape, working together so that you're more competitive to access funding that is shrinking and seems harder to receive these days. So that really stuck out to me. So thank you for
Absolutely.
coming and
Thank
talking about
you.
that. And Lamont, I don't want to step on your toes. Do you want to do Q&A, or do you want me to do it?
You always do it so wonderfully,
Okay,
Carrington, but I'm
great.
open. Thank you.
Perfect. All right, well, I'm going to ask the first question that came in from Chris Hollis, which is a question related to the Evolution Foundation feasibility for this project. So can you tell us a little bit about what you estimate in terms of the percentage of time, staff, resources that the Evolution Foundation has spent working on the Tulsa program?
So as the lead project, I would probably say about 20% of my time is spent working with the lead project. We have community meetings, monthly community meetings with community coalitions, building the training build in the training opportunities for not only community families as well as these providers, facilitating that work, as well as, we have a group that are really training around the efforts of advocacy, helping them to understand the importance of advocacy at all levels. And so we've broken each of those goals down and have specific opportunities for the community, and really they identified the opportunities that will be important. We did workforce development plans with all the organizations. And so around those plans, we looked at some of the things that are similar across those organizations in order to provide them with training and TA.
Terrific. Thank you so much. Chris also has another follow-up question, so I'm going to ask you that one next. But for everyone else that's here in attendance, please feel free to enter your questions into the Q&A box. We have plenty of time to address those. This question is around capacity building objectives. They're great, Chris says.
Mhm.
And how long has this project been going on, and how long is it projected to take place to gain the objectives that you have?
So I want to answer this in a twofold, because prior to the Robert Wood Johnson grant coming out, we had started working with Lamont and the systems alignment community. We would often bring some of the concerns of the community to Lamont in order to talk through. So we've been working in the North Tulsa community since 2023, early 2023, really developing the coalition, identifying coalition goals, needs assessment. And so we started in 2023. And so when the funding came out and we were awarded the funding, that gave us the capacity to utilize funds to implement things like training opportunities, community and family resource events, as well as opportunities for, as I mentioned, grant, financial opportunities, the workforce development plan. So we've been doing this with this particular community since 2023.
Can I just say I think you're not giving yourself enough credit there, Shamika, because I remember starting this during COVID in lockdown, and she contacted
Yeah.
me and she said, "Gee, I want to do something with this community." And we started looking, we started pulling the data
Yeah.
to see the differences, and she sent me out to all of those agencies to look at their data
Agencies.
individually, and and to come back and say, their data, the data that they're collecting for the state, the Medicaid data looks pretty good with the outcomes, but they didn't really have an understanding of how to use that data to go back to the state and say, we need more money, we need more funding. So they were kind of operating on shoestring budgets and just making
Right.
do. And they were doing they had great individual outcomes with that, but they weren't able to grow. They weren't able to grow their organizations, and they really were not able even to get out into the community much and do advocacy because they really were so focused on trying
Yeah.
to work with individuals. And so that was in 2020. And so she
Yeah.
would call me
So,
every once in a while and say, we got to look for funding. Okay, I saw this
yeah.
project come up,
So,
and we would update this. So I think, this has been
longer
a
than
matter close to her heart for
2023.
a long, long time.
Yeah. So, little known fact, prior to 2023, I was the director of Children, Youth, and Family Services for the State Department of Mental Health and Substance Abuse Services. And oftentimes, when you leave a position, folks say, if there was one thing that you wish we could have done a better job at, what was that? And that was the thing. I really wished that from a state perspective, we would have looked at better opportunities for minority communities to advance. I wish that from a state perspective. And so, when I left the State Department of Mental Health, that was one of the first things that I set my eyes on. How do I continue to work with this community in order for them to build the infrastructure and the capacity that they need to better serve and support the community? So it does go back to pre-COVID. But the funding didn't come. I mean, the funding was like it was during these times, the funding was, I mean, that was so impactful because then we had the financial resources to do something.
That's great. Thank you, Shamika and Geneva, for stepping up and tooting Shamika's horn for her. Um, Shamika and Geneva, do you want to tell us a little bit about like what future plans look like for you?
Yeah, we're really excited for 2026 because I think that um, 2025 was really setting the foundation, identifying what we needed to happen, really doing a lot of inventory with these organizations based on what they needed and really what the community needed. And so a lot of the planning and really work. And then I think in 2026, we got to a place with the coalition where the anger kind of subsided because you can imagine when this resurfaced in 2020, people were really upset, and that's really all they wanted to talk about was really what that impact was. So we've gotten a community where again we have the ability to strategically plan and work, and so now 2026 will be about moving forward with a lot of the trainings that we have identified, strengthening up the workforce development plan, really looking specifically with each of those organizations and working with them on advancing and developing their internal infrastructure for their organizations. And then also going back and looking at service data. How has this been able to have an impact on the children, youth, and families that you serve? We believe and we know without a doubt that these organizations were doing really good work. So we feel like putting some of this infrastructure in place is really going to allow us to tell the story on how great these organizations are. In addition to that, we feel like looking at the small data sample that we had and the outcomes that they had, now they will have the ability to expand to serve more people. And so what that means is it has a tremendous impact on the community and the families in the community. So that's what we're looking forward to in 2026.
Wonderful. Is there anything, I guess I'm kind of putting you on the spot here, but anything that the community here that's listening today, like, are there any needs that your team has, or like, can I invite people to be thought
Oh,
partners for you as you're moving
I,
forward?
Yeah.
yeah, I think one of the things that was really, I have to say that was really shocking for us was the fact that how can I say this? When the conversations around the nation took place around interfacing and making specific decisions around people of color or specific decisions around populations, DEI as an effort. And so as we begin to work with systems, public systems, those conversations were interesting. And I think people really wanted to shy away from that equity type of conversation that we were having. I think things are getting a little bit better now. And so I think that, again, the better Robert Wood Johnson can help to support us in our language and in our conversations, because you still have to muff that language when you're talking to specific systems, when you're talking to policymakers, when you're talking to people who are decision makers, because we're in a time where people are hesitant to be aligned with things that have to do with equity, things that have to do with populations of people of color. And so I just think that we understand the timing that we're in. And so sometimes we have to tailor what it is that we're trying to do in a way where people can hear us and understand the need. And so thank goodness for Lamont and Dr. Melissa for the work that they do, always being a part of TA and allowing us to talk through some of the issues that we have on the ground, because they're real. These issues are real. And I think that the public media and the way it's being portrayed now makes it sometimes a little bit tougher. So we're in a tough time, but we're grateful for this opportunity because it allows us to continue to keep moving the pendulum forward as it relates to communities like the North Tulsa community.
Thank you. I don't see any other questions in the Q&A box, but I do see a comment that just says extremely well-developed work, very inspiring, and thank you for sharing from Sam Hurst. So I wanted to make sure that you saw that.
I have maybe a closing question for
Sure.
Shamika. And Shamika, I just appreciate you. The moment I first met you, we were on a panel a long time ago. You're so inspiring, and the heart of your work is really building community power too. And your background with behavioral health and trying to build that equity, right, by having people closest to the issue being more involved in the design
Absolutely.
and governance. What would you leave with us? So many folks are experiencing like a moral exhaustion and
Mhm.
fatigue, with what's happening in our world to immigrants and refugees and long-term residents. And those of us, as community organizers, practitioners, system partners, community researchers, academic researchers, like what would you want to leave with us or encourage us to stay in this marathon, right?
Yeah.
And when it could be so crushing and so draining.
Yeah. So Lamont, I mean, this work is dear to me, and I get teary-eyed. And so first, let me just say this. I am grateful to have a mentor like the founder of the Evolution Foundation, Jeff Talent, who allows me to be transparent, who allows me to seek adventures and opportunities that uplift people across the state of Oklahoma and other places. In addition to that, I think one of the most important things that I took for granted, I didn't realize I needed the community that you facilitate. And Dr. Espera, the community has been such a breath of fresh air because those the conversations that we have are happening in pockets. But I often think that these conversations are happening with individuals all across the United States. So having that safe place to have dialogue, to talk about real issues that are impacting our community, to have people that are in that safe place that understand and respect the work that we're doing and the work that they're doing. And so I think that those communities of practice have been a huge opportunity to really lift us up and to continue this type of work. Because sometimes when you're working with some of the restrictions, we know the big funders are the government, we know the big funders are state entities, and you can't have these conversations in some of those places. So I just say I'm grateful for those opportunities. And so our ability to expand opportunities where people can talk about these types of issues can be extremely important for communities across the United States.
Thank you, Shamika. And I think I could speak on behalf of Dr. Espinosa and our team. It's such a privilege. Like we benefit. It's like we're all supporting each other in the work. And you're such a great leader and an inspiration to us too. And so, but you really did a nice tee up for the Community Power Network. And so I don't know if
Absolutely.
we have a link, but if you go to the Systems Alignment Innovation Hub website and check out our Community Power Network. But like Shamika, sorry, we all just come together and support each other and inspire each other and learn from each other. So we would love to have you, and it's open to anyone that's engaged in making our community a better place.
Thank you. I think that's a great note to end on. Go find your communities. And if it happens to be the Community Power Network with the System Alignment Innovation Hub, terrific. I see a link has just been posted in the chat. Shamika and Geneva and Jeff, thank you so much for joining us today in the Research and Progress webinar. And thank you to everyone who attended. We appreciate you being here and listening in. And I'm going to go ahead and close us out today, but we will follow up with the recording and the PowerPoint slides and also links to potential resources that were shared during today's webinar, including the System Alignment Innovation Hub Community Power Network. So thank you so much and have a great rest of your Wednesday.
Thank you.